This is the clavicle bone, which is also known as collarbone and beauty bone. The clavicle is located between the rib cage, sternum, and the shoulder blade scapula. It is the bone that connect the arm to the body. ये clavicle bone है, उसे beauty bone और collar bone भी कहा जाता है. Clavicle supports the shoulder so that the arm can swing clearly away from the trunk. The bone has a cylindrical part called a shaft. Shaft has two ends. This one is a lateral end and this one is a medial end. Always remember, during holding of clavicle bone, during presentation and viva examination, convex side of the bone is always our face side in left and right bone, and concave side is the outside. This is the right clavicle bone holding position and this is the left clavicle bone holding position during examination. This is the shaft and shaft is divided into lateral 1/3 and medial 2/3. The shaft is slightly curved, so that is the convex forward in its medial 2/3 and concave forward in its lateral 1/3. Always remember, the lateral end is a flat and the medial end is a large and quadrilateral. First we are discussing about lateral 1/3. Lateral 1/3 has a two border, anterior border and posterior border. Anterior border is a concave forward and the posterior border is a convex backward. लेटरल 1/3 में दो बॉर्डर रहती है, एंटीरियर बॉर्डर और पोस्टीरियर बॉर्डर. एंटीरियर बॉर्डर कॉन्केव रहती है और पोस्टीरियर बॉर्डर कॉन्वेक्स रहती है. Lateral 1/3 has a two surface, superior surface and inferior surface. Superior surface is a subcutaneous and the inferior surface present an elevation called the conoid tubercle and a ridge called the trapezoid ridge. लेटरल 1/3 में इंफीरियर सरफेस के पास तीन लाइनिंग जैसा होता है, उसे ट्रेपेजॉइड रीज कहा जाता है, और जैसे उभार रहता है उसे कॉर्नोइड ट्यूबरकल कहा जाता है. नेक्स्ट वी आर डिस्कसिंग अबाउट मीडियल 2/3 ऑफ द शाफ्ट. इट इज अ राउंडेड and a four surfaces. Medial 2/3 has a four surfaces. Anterior surface is a convex forward and posterior surface is a smooth. The superior surface is rough in its medial part and the inferior surface has a rough oval impression at the medial end. Next we are discussing about end. First is the lateral end. Lateral end is also known as the acromial end. Is a flat from above downward. It bears a facet, the articulate with the acromial process of the scapula to form the acromioclavicular joint. यहाँ पे दोनों क्लेविकल बॉन में जो लेटरल एंड रहता है वो स्कैपुला में एक्रोमियन प्रोसेस के साथ लिगामेंट के थ्रू जॉइंट होता है और एक्रोमायोक्लेविकुलर जॉइंट बनाता है. दिस इज द मीडियल एंड विच इज ऑल्सो नोन एज द स्टर्नल एंड. इट इज अ quadrangular and articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. The articular surface extends to the inferior aspect for articulation with the first costal cartilage. और दोनों साइड के जो मीडियल एंड रहते हैं वो स्टर्नम में जो क्लेविकुलर नॉच है वहाँ पे जाके जुड़ के स्टर्नोक्लेविकुलर जॉइंट बनाते हैं.